121. What is the most effective way to prevent TB transmission? A. Hand hygiene. B. Wearing gloves. C. N95 mask usage. D. Frequent sputum testing. Answer: C. N95 mask usage. Rationale: N95 masks filter airborne particles, reducing TB spread. 122. How is BCG vaccination efficacy tested? A. PPD skin test. B. Chest X-ray. C. IgRA test. D. There is no routine test. Answer: D. There is no routine test. Rationale: no standardized test determines BCG vaccine efficacy. 123. What is the most common cause of death in untreated TB? A. Renal failure. B. Respiratory failure. C. Sepsis. D. Cardiac arrest. Answer: B. Respiratory failure. Rationale: TB leads to progressive lung damage, causing respiratory failure. 124. What is the recommended initial TB screening test for healthcare workers? A. IgRA test. B. PPD test. C. Chest X-ray. D. Sputum culture. Answer: B. PPD test. Rationale: PPD is the standard TB screening for healthcare workers. 125. Which body organ is least likely affected by extrapulmonary TB? A. Brain. B. Liver. C. Heart. D. Skin. Answer: C. Heart. Rationale: TB rarely affects the heart. 126. Which TB drug is avoided in pregnancy? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide is not recommended due to limited safety data. 127. What is miliary TB? A. TB with lung nodules spread via bloodstream. B. TB affecting bones. C. Drug-resistant TB. D. TB affecting only children. Answer: A. TB with lung nodules spread via bloodstream. Rationale: miliary TB occurs when TB bacteria spread hematogenously, forming millet seed-like lung lesions. 128. What is the gold standard for diagnosing active TB? A. Chest X-ray. B. IgRA test. C. Sputum culture. D. PPD test. Answer: C. Sputum culture. Rationale: a positive sputum culture confirms active TB by detecting Mycobacterium tuberculosis. 129. Which TB drug causes peripheral neuropathy as a side effect? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: B. Isoniazid. Rationale: isoniazid can cause peripheral neuropathy due to vitamin B6 deficiency. 130. What is the recommended treatment duration for drug-sensitive pulmonary TB? A. 3 months. B. 4 months. C. 6 months. D. 12 months. Answer: C. 6 months. Rationale: the standard TB treatment regimen lasts 6 months, 2 months of RIPE, followed by 4 months of INH and RAF. 131. What is the most common side effect of rifampin? A. Optic neuritis. B. Hepatotoxicity. C. Kidney damage. D. Hyperglycemia. Answer: B. Hepatotoxicity. Rationale: rifampin can cause hepatotoxicity, requiring liver function monitoring. 132. What is the purpose of directly observed therapy, DOT, in TB management? A. To prevent drug resistance. B. To reduce costs. C. To shorten treatment duration. D. To diagnose MDR-TB. Answer: A. To prevent drug resistance. Rationale: DOT ensures adherence, reducing the risk of drug-resistant TB. 133. Which population is at the highest risk for TB reactivation? A. Infants. B. Immunocompromised individuals. C. Athletes. D. Smokers. Answer: B. immunocompromised individuals. Rationale: conditions like HIV, chemotherapy, and diabetes increase TB reactivation risk. 134. What is the primary reason BCG is not widely used in the U.S.? A. High TB prevalence. B. It causes severe side effects. C. It interferes with TB skin tests. D. It is ineffective. Answer: C. It interferes with TB skin tests. Rationale: BCG can cause false positive PPD results, complicating diagnosis. 135. What is the hallmark of primary TB infection? A. Lung cavitations. B. Miliary TB. C. Gone complex. D. Pleural effusion. Answer: C. Gone complex. Rationale: Gone complex is a lung lesion seen in primary TB. 136. What type of isolation is required for active TB? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions. Answer: C. Airborne precautions. Rationale: TB spreads via airborne droplets, requiring airborne precautions. 137. Which test differentiates active TB from latent TB? A. PPD test. B. IGRA test. C. Chest X-ray. D. Sputum culture. Answer: D. Sputum culture. Rationale: only sputum culture confirms active TB, whereas IGRA and PPD detect exposure. 138. Which TB drug requires monthly vision testing? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: D. Ethambutol. Rationale: ethambutol can cause optic neuritis, necessitating regular vision checks. 139. What is the most common extrapulmonary site of TB infection? A. Skin. B. Bones. C. Lymph nodes. D. Intestines. Answer: C. Lymph nodes. Rationale: TB commonly affects the lymph nodes, leading to scrofula, tuberculous lymphadenitis. 140. What is the first-line treatment for latent TB? A. Rifampin for 4 months. B. Isoniazid for 9 months. C. Ethambutol for 6 months. D. Pyrazinamide for 2 months. Answer: B. Isoniazid for 9 months. Rationale: isoniazid monotherapy for 9 months is the preferred latent TB treatment. 141. Which of the following is a classic radiologic sign of reactivated TB? A. Pleural effusion. B. Gone complex. C. Apical cavitary lesions. D. Diffuse infiltrates. Answer: C. Apical cavitary lesions. Rationale: reactivated TB typically presents with cavitations in the lung apices. 142. What is the most common symptom of active TB? A. Chest pain. B. Night sweats. C. Weight gain. D. Runny nose. Answer: B. Night sweats. Rationale: classic TB symptoms include night sweats, fever, cough, and weight loss. 143. What is the primary mode of TB transmission? A. Fecal-oral. B. Bloodborne. C. Airborne. D. Direct skin contact. Answer: C. Airborne. Rationale: TB spreads via airborne droplets expelled during coughing or sneezing. 144. Which TB drug can cause hyperuricemia and gout? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide inhibits uric acid excretion, leading to hyperuricemia. 145. What is a serious complication of untreated TB? A. COPD. B. Pulmonary fibrosis. C. Respiratory failure. D. Asthma. Answer: C. Respiratory failure. Rationale: advanced TB can cause extensive lung damage, leading to respiratory failure. 146. What is the most effective TB prevention method in endemic areas? A. BCG vaccination. B. Wearing gloves. C. Taking antibiotics. D. Avoiding dairy products. Answer: A. BCG vaccination. Rationale: BCG provides partial protection against severe TB in high-risk areas. 147. What does MDR-TB refer to? A. TB resistant to rifampin and isoniazid. B. TB that spreads faster than usual. C. TB with no symptoms. D. TB only affecting the elderly. Answer: A. TB resistant to rifampin and isoniazid. Rationale: MDR-TB is resistant to both isoniazid and rifampin, requiring second-line drugs. 148. What is the recommended isolation period for a TB patient starting treatment? A. 48 hours. B. Until symptoms resolve. C. Until 3 consecutive negative sputum smears. D. 1 month. Answer: C. Until 3 consecutive negative sputum smears. Rationale: patients remain infectious until 3 negative sputum smears confirm non-contagiousness. 149. Which factor increases the risk of drug-resistant TB? A. Poor medication adherence. B. High-protein diet. C. Exercise. D. Early treatment initiation. Answer: A. Poor medication adherence. Rationale: incomplete treatment allows Mycobacterium tuberculosis to develop resistance. 150. What is the tuberculin skin test measure? A. Exposure to Mycobacterium tuberculosis. B. Active TB infection. C. Drug resistance. D. Immune response to treatment. Answer: A. Exposure to Mycobacterium tuberculosis. Rationale: a positive PPD test indicates past or current TB exposure, but does not confirm active disease. 151. Which first-line TB drug can cause discoloration of body fluids? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer: B. Rifampin. Rationale: rifampin turns urine, tears, and sweat reddish-orange, which is harmless. 152. What is the function of pyrazinamide in TB treatment? A. Prevents bacterial cell wall synthesis. B. Inhibits RNA synthesis. C. Lowers pH inside bacterial cells. D. Inhibits folate metabolism. Answer: C. Lowers pH inside bacterial cells. Rationale: pyrazinamide disrupts TB bacteria by reducing intracellular pH. 153. Which test confirms latent TB? A. Sputum culture. B. Chest X-ray. C. IGRA test. D. Bronchoscopy. Answer: C. IGRA test. Rationale: IGRA, interferon gamma release assay, detects latent TB by measuring immune response. 154. What is a major concern when treating TB in HIV-positive patients? A. Drug interactions with antiretrovirals. B. Faster bacterial clearance. C. Less infectiousness. D. Shorter treatment duration. Answer: A. Drug interactions with antiretrovirals. Rationale: rifampin interacts with antiretrovirals, requiring dose adjustments. 155. Which organ is most commonly affected in extrapulmonary TB? A. Liver. B. Brain. C. Kidneys. D. Lymph nodes. Answer: D. Lymph nodes. Rationale: lymph node TB, scrofula, is the most common extrapulmonary manifestation. 156. What is the primary role of ethambutol in TB therapy? A. Prevents bacterial cell wall synthesis. B. Inhibits DNA replication. C. Disrupts mycolic acid synthesis. D. Blocks folate production. Answer: C. Disrupts mycolic acid synthesis. Rationale: ethambutol inhibits cell wall formation by targeting mycolic acids. 157. What is the key symptom distinguishing active TB from latent TB? A. Weight gain. B. Productive cough. C. Skin rash. D. Headache. Answer: B. Productive cough. Rationale: active TB typically presents with a chronic productive cough, often with hemoptysis. 158. Why is vitamin B6, pyridoxine, given with isoniazid? A. To prevent hepatotoxicity. B. To reduce neuropathy risk. C. To improve drug absorption. D. To enhance bacterial clearance. Answer: B. To reduce neuropathy risk. Rationale: isoniazid depletes B6, leading to peripheral neuropathy. 159. Which TB drug is contraindicated in pregnancy? A. Rifampin. B. Isoniazid. C. Streptomycin. D. Pyrazinamide. Answer: C. Streptomycin. Rationale: streptomycin is an aminoglycoside that can cause fetal ototoxicity. 160. What is the primary aim of contact tracing in TB control? A. To diagnose TB early. B. To monitor treatment adherence. C. To prevent drug resistance. D. To identify and treat exposed individuals. Answer: D. To identify and treat exposed individuals. Rationale: contact tracing helps detect TB early in exposed individuals, reducing spread.